Hi, it's your girl here, Evelyn. I'm here again, and this time I want to talk about diabetes. What is diabetes? Diabetes is a chronic medical condition that affects how our body store energy. Diabetic is prevalent among African people, immigrant, people with low economic status, Latino, Asian, and Native. Diabetes is the seventh leading cause of death in America and Canada. There are 34.2 million people in America that is diabetic. Of that, 26.9% of people are undiagnosed. In Canada alone, there's 3.4 million people who have diabetes. That's about 9% of the Canadian population. And it is estimated that in 2025, that number is going to grow to 5 million, which is 12.1% of the Canadian population. That's quite a lot. People with diabetes are at higher risk of developing severe complications such as blindness, stroke, kidney disease, heart disease, lower limb amputation, at risk of developing some kind of cancer such as the pancreatic cancer, breast cancer, liver cancer, and also they are also at higher risk of developing vascular dementia and Alzheimer. The main organ that controls our blood sugar is the pancreas. So the pancreas is located in the upper quadrant of the abdomen. So they have two functions basically. They as an exocrine function and an endocrine function. An exocrine function is that they release enzymes such as lipase, protease, and amylase. The lipase break down lipid, the protease break down protein, and the amylase break down starch and carbohydrate. So they do that. They also releases as an hormone function. They release two hormones, insulin and glucagon. So with insulin, in response to maybe after you eat maybe carbohydrate or protein or any kind of food, the body breaks it down. The pancreas releases those enzymes that I just mentioned that breaks down the food into simple sugar in your bloodstream that trigger insulin to be released. Once insulin is released, insulin will move those sugar into the cell for energy. That's how a normal body works. In a diabetic individual, they're not able to do that for two reasons. There are two types of diabetes. There's a type 1 diabetes and there's a type 2 diabetes. A type 1 diabetes is an autoimmune disease where the cells are attacking themselves. So in this case, the individual with a type 1 diabetes cannot produce insulin, or they produce very small amount of insulin. In this case, the insulin is not working effectively. They're not able to transport the sugar, the excess sugar in the bloodstream into the cell. In this case, your blood sugar remains elevated and thus you're diagnosed with diabetes. Type 1 diabetes is common among children, youth, teenager, and just younger children basically. So it occurs in about 5 to 10% of people. Type 2 diabetes is more common compared to type 1 diabetes. It occurs in adults and children as well. 90 to 95% of population does have type 2 diabetes. Risk factor for type 2 diabetics would be age, because of children can get it, adults can get it. Family history, if your mom and dad has diabetes, you're prone to have diabetic as well. Age 45 and above, overweight, if you're not physically active. And like I mentioned earlier, the group of people that are prone to develop diabetes would be African American, immigrant, people with low economic status, Asian, Native. Those are the risk factor for developing diabetes. A type 2 diabetes is different from a type 1 diabetes. In a type 2 diabetes, the individuals are able to produce insulin, but the cells are not responding to insulin. So the insulin is not working effectively. So they are insulin resistant. So because of that, your blood sugar remains elevated, and they're not able to transport this blood sugar into the cell to get energy. So over time, it's going to lead to kidney disease, heart disease, stroke, blindness, and all the other complications that I mentioned earlier. So it's important that we get our blood sugar in check in order to prevent this from happening. What are the symptoms of diabetes? How do you know you have diabetes without checking your blood sugar? Well, I'm here to tell you that. Peeing a lot, especially at night. Losing weight without making any effort. Feeling tired and feeling dizzy. Feeling numbness and tingling in your periphery, like your lower limbs. Another one would be dry skin, feeling hungry, blurry vision, and also wounds. You have wounds and it never heals. You use the right dressing, it's just never healed. And the last one would be recurrent infection. Continue to have recurrent infection and all that. So how do you know you have diabetes? There are 3 tests I'm going to mention today to confirm that you have diabetes. Testing your blood sugar. So the first one would be the hemoglobin A1C, the one that your doctor orders every 90 days. So the A1C actually measures the average of your blood sugar over time in the last 90 days. So they take that average, and the number we're looking for is less than 5.7%. So that would have been a person with less than 5.7% would be normal. If it's around greater than 5.7 to 6.4, that would have been a pre-diabetic. A pre-diabetic is you're like at that borderline where you have diabetes, but you're not fully diagnosed yet. So a 6.5 or above for hemoglobin A1C will be a diagnosis for diabetes. The second test I'm going to talk about is the fasting blood sugar. The fasting blood sugar measures your blood sugar overnight after fasting for 8 hours or more. So basically the number we're looking for a normal blood sugar after fasting, it should be between 70 to 99 milligram per dl, which is about 3.9 millimole per liter to 5.5 millimole per liter in Canadian, if we're converting it to the way we do it here. For a pre-diabetic, that's a person with a borderline diabetes, number we're looking for would have been 100 to 125 milligram per dl, which is about 5.5 millimole per liter to 7.0 millimole per liter. So that would have been a number we're looking for if you are at the borderline for being diagnosed with diabetes. And the third number we're looking at for the person who is fully diagnosed with diabetes will be a number greater than 7 millimole per liter, which is about 126 or above milligram per dl. So anything above that will be considered diabetes. Third test is the random blood sugar. This is after you've eaten, you're not fasting or anything, you're just measuring your blood sugar just to see how it is. You've eaten actually around this time. So if you have a number that is 200 milligram per dl above or more, which is about 11.1 millimole per liter, you are diagnosed with diabetes. Diabetes, and over time, like I mentioned, this can cause severe complication, blindness, cardiovascular disease, kidney disease, stroke, cancer, all kinds of things. So it is important that we get our blood sugar in check, because people who are diagnosed with diabetes have 50% higher risk of early death compared to people with no diabetes. But the good news is that if we are able to manage diabetics appropriately by taking the right treatment, by knowing what to eat, lifestyle changes, working out, being physically fit, taking your medication appropriately, we are able to prevent all of this from happening. Hope you enjoyed my show. Thank you.